Ready, set, go.
Okay. What we see here is 4 sections of the histology of the GI tract. The first one up here is supposed to represent the esophagus. This is all mucous membrane here because it's open to the outside. In the esophagus, we still have continuing from the stomach and the part of the pharynx down to the esophagus, stratified squamous because of wear and tear. Then we have a lamina propria underneath it, and muscularis mucosae, a little thin layer of muscle. Then we have the submucosa, which you can see some glands here, blood vessels, and then 2 layers of muscle, the muscularis, okay? Circular muscle and longitudinal muscle. Circular and longitudinal. And then the outer portion is called the adventitia. When we get to the stomach, we have a transition because we go from having stratified squamous to simple columnar. And the tissue is going to stay simple columnar all the way through the rest of the GI tract until we get to the anus, where it goes back to stratified squamous. So here, the stomach also, instead of having 2 layers of muscle, we have 3 layers of muscle here, an extra inner oblique layer. And of course here we have a lot of acid produced by the parietal cells. We have pepsinogen produced by the chief cells. We have also intrinsic factor from the parietal cells. When we get to the small intestine, we have villi. One of the things increases the surface area. We have circular folds, villi, and microvilli. In some parts of in the duodenum, you have lots of Brunner's glands. When we get as far as the ileum, then we're going to have lots of Peyer's patches. But these 3 things of circular folds, villi, and microvilli increase the surface area 600-fold over what it would be if it was just straight tube. When we get to the large intestine, we no longer have circular villi, we no longer have, circular folds, we no longer have villi. We still have microvilli, we still have lots of mucus being performed here. This is where we have a lot of digestion by, enzymatic digestion. It's E. coli producing lots of vitamins, and so they're doing a lot of the work in the large intestine here. We're in the small intestine, in the duodenum, we also have the entrance of bile and pancreatic enzymes, and the brush border enzymes also help with digestion a lot.